You are listening to Kickspot.
And we are back. So I want to ask you to actually I just want to give you to my perspective on the medical industry. Obviously, I didn't go into that realm, and I have my little skepticism and stuff like that. And this is not just as I've been talking to a few of my other friends, there's a small percentage of people that also think this way as well too. So it was a little reassuring knowing that, but then also hopefully you're able to kind of influence me the other direction, because obviously you both are my friends and I don't want to make the medical industry look bad. But my perception, so a little story. So I've never really liked the medical industry. Just because back in the day, and I still get this now, I used to get these big migraines, and these migraines would get so bad that I would lose my vision. And during my sophomore year in college, I took the time to go to 5 different doctors, and all 5 of them gave me different diagnosis. I started drinking coffee during that time because one of the diagnoses was to drink a cup of coffee a day. They had let me know that there's calcium that constantly goes into my brain, and in order for it to close, there's like holes in the brain or something. And calcium goes in and out. In order for it to close, if you drink coffee, it closes it, so you don't get a bunch of calcium. That's what causes the migraine. I didn't really understand that concept, but that's exactly what they told me, and so I've been addicted to coffee ever since. That got me a coffee in a one of those hot cup. This is like an iced coffee, which is really weird that he gave it to me in this little cup. But I've never drank coffee before that. But I've just been very, very skeptical about the diagnosis, and I read a lot of data, not just in the medical industry. I just like data in general, and I've always understood that there's no guarantee within a diagnosis, and it's all about the data that's been created from the past, right? So what is your perception? I mean, like I said, a few of my friends have also expressed the same thing. What is your perception on people that think like me?
Yeah. So nothing is black and white, and unfortunately for some things we can't give you an exact diagnosis. So we come up with what's called a differential diagnosis. So we can come up with the top 5 things we think it could be based on your symptoms, based on labs, based on imaging. And so after that, we try to rule out different diagnoses based on the information we have. Unfortunately, things like headaches and different pain disorders, it's not, black and white. You can't always come up with an exact diagnosis compared to something like a broken bone, where you can see it on imaging and hey, that's a broken bone. So sometimes it's really difficult to finalize a diagnosis. And really sorry to hear about your experience. Hopefully we can refer you to some people that can help you out with that.
Get some help.
Yeah, with the headache. I mean, migraine can be debilitating, and if it's causing you visual problems, love to see you get that addressed.
Yeah, I mean, someone could lose trust in the medical field if they're going to see 5 different specialists and they're getting different information from all five different specialists, and nobody is giving you something that works and actually helps and remove the pain, right? So, unfortunately, sometimes there are things that are rare or don't work for patients, and based on our judgment and based on previous examples and what we learn, that's what we base all our management with.
Yeah, and I think what doesn't help is how expensive medical bills are. And it wasn't just the amount of coffee that I was drinking that I was spending money on. I was diagnosed like a syringe. So I'd have to do a self-insertion whenever I would start feeling or start losing the vision. And I was spending so much money on that, and none of that helped. I still lost my vision. I still had a big migraine. I was sensitive to light. So if there's any doctors out there that could diagnose, I'm doing a diagnosis right now, obviously. So, hit me up on Instagram, and then, give me the actual reason. But it's just so disheartening knowing that I'm spending all this money and nothing has helped. And I'm sure there's a lot of people out there currently right now that that feel the same exact way, that the medical industry is just so expensive. Healthcare for all hasn't been the most effective in a lot of cases. And so that's one of the big reasons why I also lose trust. And if I knew the actual doctor and they didn't charge me, for example, and they spent more on quality versus quantity, then I think I would be more inclined to listen and figure things out, kind of like a personal coach.
Sure.
But doctors don't necessarily have all that time. They still have, millions and millions of people that they have to see as well. So I'm kind of in a catch-22.
Cost is definitely an issue. In the United States, we spend the most on healthcare than anywhere in the world, and we don't even have the best health outcomes. So trying to contain costs has been a big issue. I don't think we're getting any better at it. So I think we need to change the entire structure moving forward. But just so you know, all the money is not going to the doctors, but we do need to improve that aspect of medicine.
Yeah, that aspect is slowly, shifting. Before, a lot of payments were paid by quantity. So if you do, 10, 20 procedures, you'll get paid more than if you did 5 procedures. But the shift right now is for reimbursements, at least, is to quality, and outcomes. So if you improve a patient's outcome, you would get paid. If you don't, then you wouldn't get paid. So the importance now has shifted more to outcomes based.
It's kind of like a Yelp review. So I give you a good Yelp review, then you get paid. If I give you 0, then you're probably losing out on customers.
Exactly.
Oh, that's interesting. And is that recent that they started doing that, or?
Very recent. So taking patient outcomes, patient satisfaction. It's now like a bundle payment.
It's more than it's more than a Yelp review, because it also takes like objective outcomes plus patient satisfaction plus. And then,
Is that just at this hospital?
No.
It's all over.
Yeah.
Okay.
I think it came with Obamacare.
Yes.
Oh wow. So it gives me a little bit more confidence. I mean, like I said, the last time I think the last time I went to.
Yeah. So like that would prevent like somebody from suggesting like a necessary surgery, right? That wouldn't help you, but I'm still gonna do it to make money.
Well, that's good to hear. I want to transition into the myths and facts about doctors.
Okay.
And then I just want to tell you the premise. It doesn't have to be about you too. It could be about your friends or people that you know of. If it's negative, then it could be about other people. But the first one I have on here is doctors make a lot of money. Myth or fact?
I think it's a myth. We eventually doctors can live a comfortable lifestyle, but debt out of medical school, 6 figures on average. Everyone who goes into the medical field, they're delayed in making money like 4 to 10 years, depending on how long the residency or how long the residency is, depending on the specialty. So compared to your peers who started working at 22, they've been making money since they're 22. Whereas let's say we start at 30, we're 8 years behind. So if you look at like the cumulative, how much money each of us make, the 22-year-old would beat us, and also taxes.
I would agree with everything Patrick said. We can live a comfortable lifestyle with the compensation that we get, but definitely aren't rich. Don't make a ton of money. Do a lot of schooling and have a lot of debt, and can live a comfortable lifestyle.
Yeah, we're not gonna be on like the same level as like a ball player or like a musician like yourself.
Well, why do you think that's a perception though? The doctors make a lot of money.
Because I guess it's a reputable career. You become like an expert in a field. Maybe back in the day too. Back in the day, the doctors made more compared to these days as well.
Do you think that's still the perception?
Of course, yeah, that's
Definitely.
Okay. If that is the perception, let me ask you this question. Have you ever told someone that you liked that you were a doctor, knowing that perception, just to kind of get an in?
Maybe once or twice. Yeah, definitely.
Yeah, I mean, we went through so much training, right? So I'm proud that I'm a doctor, and sometimes if like I usually try to not on the like for a stranger or like on a first date, but eventually that's something important that two people would talk about.
Yeah, it's interesting because like the perception of a doctor to a lot of people is like, okay, you make a crap ton of money, and then you look at somebody like, let's say, a garbage man. But garbage men make a lot of money. Like if you look at a government website, they actually do make a lot of money. And really, in my opinion, there's really two ways to be wealthy in America: is you do things that people can't do, or you do things that people don't want to, things that other people don't want to do, which a lot of people don't really want to be a garbage man. And so I have a lot of respect in that industry. But it's funny because if I was a garbage man and went up to somebody and said, "Hey, I'm a garbage man," like I don't think that people would be like, "Oh," but hey, I'm in debt.
Yeah.
I'm a doctor. People are just drooling over that. So it's very interesting, the perception that people have. So number 2, doctors are smart.
I would say we're fairly smart. We go through a lot of schooling. As Patrick mentioned, 4 years of undergrad, 4 years of medical school, and then training anywhere from 3 to 9 years. And so you develop a lot of knowledge, learn a lot of certain skill set, and we're learning all the time.
Yeah, I think you need to have some baseline intelligence to be able to learn all the material in medical school and study and pass all your licensing exams. So
Yeah, I would agree with that. And I also think that there's constant education that is happening within the medical industry. There's things that come up and change all the time, especially with COVID. I'm sure it wasn't a let's stop learning concept. It was obviously we need to learn so we could start helping other people. And that's another way that you can be successful, not just in the medical field, just in general. Just keep constantly educating yourself. So you do have to have, you have to be smart to be able to do that too, and be consistent. Third myth or fact: doctors hate Eastern medicine.
I think that's a myth. Hate is a strong word.
Dislike.
There are
Prefer.
There are benefits to some Eastern medicine that studies have been done, and in conjunction with Western medicine, it could help a patient. But a lot of the times, a lot of the Eastern medicine passed down by your grandparents, your great grandparents. There hasn't been a lot of, like, we don't know the ingredients in, let's say a plant, and then there hasn't been a lot of studies, like randomized controlled trials to show its efficacy, and there could be some interactions from that with Western medicine. So it's really important, whenever a patient sees a doctor, to just let them know, this is what I'm taking. Could there be certain things that could interact with the Western medicine?
Do you think that there's data being collected though? So like, in Korea, if you go to a doctor and they diagnose something, that you actually go to a pharmacist and you give them your prescription. It's not necessarily a pill, but it's herbs. They grind up all like these like deer antlers or like feet, and then they mix it and then it's like a herbal drink. But do you think that there's data out there, out in Asia versus in the US to really help?
Yeah, I haven't seen any widely published, like Patrick said, randomized controlled trials with a lot of these things. So we don't think that they're necessarily harmful. We just don't know their benefit, their efficacy, like Patrick said. And so we have a lot of patients that take a wide variety of medications that we don't prescribe. And we're generally okay with that. Like he said, we just need to know what medications they're taking. Some of them can have reactions or interactions with the medications we prescribe or cause increased risk of bleeding. But generally they aren't harmful, but we don't know what their benefit is.
Okay.
Yeah, another example is like in our field, I've seen some hospitals offer acupuncture to help with pain. That's like an Eastern medicine practice that may help if combined with Western medicine.
But acupuncture isn't necessarily accepted by all insurance companies. So I find that pretty interesting because if you have a bunch of doctors here saying that acupuncture actually works, I would assume that the insurance companies 100% would back that up. So why is it, in your opinion, that insurance companies don't 100% allow acupuncture?
I don't think it's widely accepted. Some hospitals may. Some hospitals may offer it if it's like pay out of pocket. So I think it's just like widely accepted. If more data comes out that shows this is effective, then Medicare and Medi-Cal would get on board and reimburse accordingly.
All right, number 4, doctors are healthy. Myth or fact?
Yeah, people always say that doctors and nurses are the worst patients. And so I think we can make assumptions about our health, and we don't always go to the doctor ourselves. So I think in general that we try to focus on our health, but we don't always practice what we tell our own patients.
Yeah. I think also depends on the doctors. I know healthy doctors. I know unhealthy doctors. We're both very healthy, but I also know people who, work too much, work too many nights, don't get enough sleep, eat a lot of junk food. Yeah, unhealthy.
Yeah, you would think that you wouldn't eat a lot of junk food as you're a doctor.
You never know what's available at 3 a.m. where you're on a shift and you have, 2 minutes to eat.
And the only thing open is like a vending machine.
Yeah.
Oh, that's interesting. I remember going into a fitness center one time, and this guy, as I was walking in, was eating a Big Mac. And I didn't know he was a personal trainer. And so he comes up to me and he says, "Hey, do you need a personal trainer?" And I'm like, "Not after you ate that Big Mac." That's interesting.
I'm sure that turned you off.
Oh yeah, absolutely. I couldn't do it. He looked great from the outside, but what you put in internally, I just wasn't about that, because you could fix stuff.
It's like going to a dermatologist with bad skin, or like
if you're a dermatologist.
If you're a dermatologist.
Yeah, or an optometrist, I guess, if you have bad teeth.
No, bad eyes.
Yeah, I mean, like the health thing, I correlate that to, I guess, the lack of sleep. Sometimes, as Adam, you have a pager on you for some reason. Such an old school concept. But people that have to go into emergency just in the middle of the night don't necessarily get great sleep in general. So, in my perspective, in that situation, you're not necessarily helping your health out too much, which is unfortunate. The last one, myth or fact: doctors are hard to date. And it got quiet.
I mean, I think it depends on the doctor. A lot of the times, we have unpredictable schedules. We can have, 3 cases starting at 7, but we don't know when the last case ends. So we could, have a date plan at 6 and then have to cancel. And then, so I think just our work schedule, unpredictability, long hours in the hospital. I mean, this can affect spouses even at home. Talking to a lot of people in my specialty. Can't come over for dinner, can't go to your kids' basketball game. So I think just communicating, this could happen, this unpredictability can happen, and then having a partner that understands and supports your career, I think is important.
I would agree with everything Patrick said. It's really the unpredictability of our schedule, and like he said, I've missed weddings, funerals, dates, anything you can think of, just because you never know where you're going to leave the hospital. You never know when something's going to pop up and change your entire schedule, change your entire day. And so, of course, communication around that is important, but some people just aren't understanding of that, of the time constraints of your job.
So do you think two people that are in the medical industry that are dating, is that pretty difficult? Because it seems like there's a lot of different schedules. I could see that as you guys are speaking.
Yeah, the time overlap can be difficult, but I think it would probably be better understanding because you know that
gone through the same stuff, training,
exactly.
Everything. I feel like the divorce rate for 2 doctors is pretty high for that reason, or like 2 surgeons.
Yeah,
for that reason.
So I was asking a few of my friends, men and women, And the industry that they say, as far as for people that's hard to date, is a medical industry. And it's a lot of what you're speaking about, but also the lack of trust, maybe just from a personal perspective, like within themselves, but infidelity happening. So I decided to look up the industries that have the top infidelity rate, and actually number 2 was the medical industry, which
surprising.
which was actually 5% men and 23% women. And obviously that, I don't know if it's obvious, but it's a little skewed because there's more women in the medical industry. And ironically enough, the first is trade workers, the ones that actually go into people's homes. So plumbers and electricians, 29% men and 4% women. Yeah. But so
a higher percentage of female doctors are cheating.
I like how he's like, hey, I'll take 5 over 23. But yeah, I mean, you have more women in the medical industry, so it is really skewed. So if I was to kind of weigh that out, I would say it's pretty even in that nature. What are your thoughts on that? Can you see that happening? Do you think that's top?
Yeah.
Is it top 3, top 2?
I could see it happening. We spend so much time in the hospital, right? And then you're away from your, significant other, and then, feelings can develop, relationships can develop with your staff. You're spending so much FaceTime with them every single day you come to work. I know doctors who, are committed. I know other doctors who cheat, so I think it just depends on the doctor.
Yeah, definitely. Like Patrick said, you can develop relationships with the people you work with just because you spend so much time with them. You can relate to them. You can decompress with them. And so you spending 24 hours at once with them, it can be easy to develop a relationship with them. They can start off as friendship and develop into something more. So I could see it happening.
Yeah. And that's not just in the medical industry. That's in every industry.
Sure.
Yeah.
I'm glad that when I asked about myth or fact, it was either one way or the other, and you both answered the safest answers. I could see that happening. It wasn't a hey, it's fact, or it's a myth. But great job, great job. It's like if I was to talk about politics, it's like I could see this perspective or that perspective.
Exactly.
I mean,
So.
I'm always speaking the truth. And what I see.
Well, I appreciate you two spending the time here at the hospital. I know you guys were working and you really made the time, and you still have your pager on you.
Yeah.
So any minute I was afraid that thing was going to go off during the show, but I really appreciated that. That's a good thing. Obviously, that means nothing's happening so far, or you have people obviously working that are able to handle things and control things. So I really appreciate you taking the time. But is there any other last messages you'd like to, tell the audience?
Yeah, so we're in the midst of a pandemic that we don't know much about. People are still becoming infected, contracting the virus. People are still dying. So just practice best habits that we know about: social distancing, frequent hand washing, hand sanitizer, and try to stay at home as much as possible until we know more about the virus, until we have a vaccine to help prevent the spread.
Yeah, to piggyback off Adam, stay safe. There's free testing sites in LA now. You could probably put that link up for those interested in testing. They're even testing people without symptoms. Also be cognizant of the higher risk groups, the older patient population, and also people with comorbidities like high blood pressure, obesity, diabetes, respiratory problems. So just stay safe, and thanks for having us.
All right. Do you guys if people want to reach out, do you guys have any social media?
I'm on Instagram and Twitter, both the same username, AJ Milam, MILAM, MD PhD.
Yeah, I'm one of the few who do not have an Instagram, so you can find me on Facebook, Patrick H. Lamb.
You might as well say MySpace if you're gonna.
MySpace is dead.
Wow. Tom from MySpace is like. All right. Thank you very much for listening, everybody, and stay tuned for the next show. Have a great day.
Stay safe.
Thank you for listening to Kickspot.